Good morning, one and all. I'm Pinkal Shiroya, and the topic which I'm going to discuss is long-term outcome of the deep anterior lamellar keratoplasty in pediatric keratoconus. Pediatric keratoconus is aggressive and rapidly progressive in nature, and the keratoplasty in pediatric keratoconus is always challenging because of lower scleral rigidity, general anesthesia, early suture-related problems, graft rejection due to stronger immune system of the children. The most preferred procedure was deep anterior lamellar keratoplasty. The lacuna in our literature is limited number of subjects, includes wide range of the age group, and outcome includes several other indications, not specifically keratoconus. The aim of my study to analyze the long-term outcome of deep anterior lamellar keratoplasty in pediatric keratoconus. It is a retrospective study of all the keratoconus patients less than 18 years in attending the cornea clinic, Arvind Eye Hospital, Coimbatore, in a time span of February 2008 to December 2019. All the patients underwent pre-op evaluation. They underwent slit lamp examination, visual acuity and refraction and topography. The surgical technique which was used was big bubble technique. 0.2 mm oversized button was sutured with tenor nylon. And as a post-op regimen, topical prednisolone was used in tapering dose and was later shifted to low-dose steroids or cyclosporin. This is how we are going to look at our results. 221 eyes of 185 patients underwent DALK. The age group was 6 to 18 years. In our study, 71%, that is male predominance, was seen more, and left eye was operated more. The mean follow-up period was 6 to 130 months. The most common comorbidity associated in our study was vernal keratoconjunctivitis. 39.3% patient had. Corneal apical scars were found in 6.65% of the patient. Deep scars in ASOCT was found in 1.3% of the patient. On comparing the visual outcome, the mean uncorrected visual acuity was significantly improved by 0.51 logMAR unit, and best corrected visual acuity was improved by 0.48 logMAR unit. Coming to refraction, spherical component showed tremendous improvement of 5.37 diopter, and cylindrical component showed a tremendous improvement of 2.38 diopter. The similar improvement was seen in the keratometry reading. Kmax was improved by 9.56 diopter and SIMK was improved by 3.35. 80% of patients in our study has visual outcome better than 6/12. If we compare with the other study, Arora et al. Showed 45% of the improvement, Patel et al. Showed 86% of the improvement, and Fizzi et al. Showed 84% of the improvement. Big bubble was successfully achieved in 66% of the patient, and in those patients where we could not achieve big bubble, either they were hydrodissection was done to the patient or manual dissection. If we compare the success of big bubble with other studies, Fezzi et al. Showed 75%, Nuxon et al. Showed 77%, and Arora et al. Showed 80%. But all these three studies included adult patients as well. The most common intraop complication was DM perforation. 15.39% patient had DM perforation. 20 patients with DM perforation had double AC, and they were treated with rebubbling. The first most post-op complication which we came across was glaucoma. 14.9% of the patient had glaucoma. 30 patients were treated with anti-glaucoma medication. 2 patients were treated with laser trabeculoplasty, and 1 patient was treated with TRAP. Second complication which we came across was cataract. 5.7% of the patient had cataract. The commonest type of cataract was posterior subcapsular cataract, and 5 patients who underwent rebubbling had cataract as their post-op complication. The third post-op complication was delayed epithelial healing, which was found in 70% of the patient, and 2% of the patient had non-healing ED, which was being treated with Botox injection. On coming to the suture-related complications, 49 cases had suture replacement in and around 3 months. Suture removal was initiated at around 7 months and was completed by 29 months. Coming to the graft-related complication, 13.12% of the patient had vascularization, including superficial and deep. 9.5% of the patient had graft infection. The most commonest organism was Streptococcus pneumonia. 6.67% of the patient had graft rejection, and it was treated with topical steroids. Now, among the 221 eyes, the fellow eye management protocol were 48.87% of the patient underwent C3R, 10.86% of the patient underwent DAL, and 2.71% of the patient underwent PKP. If we compare the VKC and non-VKC group, we found that delayed epithelial healing, suture-related complication, and graft rejections were found more in the VKC associated patients. These are the review of my literature. And at the end, I would like to conclude my study. The DALK is the most effective technique for the pediatric keratoconus with good visual recovery and graft survival. DALK can be associated with unique complications like DM perforation and double anterior chamber. And vernal keratoconjunctivitis needs to be addressed to avoid the complications in the pediatric keratoconus. These are my references.
Thank you. Are there any studies which compare your DALK with penetrating keratoplasty in children?
Showed, but it included adult patients as well. It was not specifically related to the pediatric keratoconus.
Were these children given an option of C3R before doing DALK?
Sir, we included those patients which had a steep cornea, which were not being eligible for the C3R criteria, like steep cornea, and whose keratometric readings were high, and whose contact lens intolerance patient, whose after C3R we could not find the improvement of the contact lens.
So some of them were post C3R?
No, sir.
None of them were post C3R?
No, sir.
How many of them with a DM perforation had to undergo penetrating keratoplasty?
Sir, 2.27% of the patient underwent.
And rebubbling was done with SF6?
Air, sir, ma'am.
Sorry?
Air, ma'am.
Only air.
Only.
Okay.